Hi guys, Dr. Champagne. I want to introduce you guys to Anna. She's the winner of our Champagne Brows model search. So Anna, tell us a little bit about what brings you in, why you were looking to improve upon your eyebrows, a little bit about your history and what you've done.
Well, I'm an actress in Mexico City. So when I was 8, my brother took my eyebrows away. They never grew again.
They never grew back?
No,
Wow.
like a little bit like this, but not like I wanted,
Right.
So I had try every single treatment, like everything, and they never grew up. So when I was trying to find something to help me, I came with you and this amazing model search, and I was like, I'm gonna do it. I need my eyebrows again. Like, it will help for my career and for my security, because I think the eyebrows change everything in your face.
I agree. They really actually frame the rest of your face. They set up the balance and structure for the rest of your facial features. So tell me a little bit about, you said you've tried everything. What have you tried?
Like a lot of treatments to grow, they didn't went out again my eyebrows, and I did microblading.
Microblading. Okay.
Yeah, 2 times.
Okay.
The last one was 1 year ago.
Okay.
And I didn't like it because at the end it's like a tattoo. So when you look at it, it's something paint, It's something in here, it doesn't look natural.
Right.
Yeah.
And maybe for those of you guys who may have heard of microblading or haven't heard of microblading, microblading is a technique where you go in and it's sort of like a tattoo artist or someone who makes little tiny incisions in the outer layer of skin and then puts pigment into that area. It does create a little bit of scar tissue in the skin. So for eyebrow transplantation, that actually can sometimes be an issue when you have scar tissue already in the eyebrows. And I deal with that when I do these procedures. So we'll talk a little bit about that as well. But microblading, like Anna was saying, and maybe you guys know too, is that it's not actual hair. It's just pigment on the skin, so it doesn't give you the three-dimensional look. It never really gives you a full-looking eyebrow. Especially if you, like Anna, have some hair, but then you have microblading pigment on the outside. You see the hair, but then it goes flat, and then you just have pigment behind that. And that never really looks completely natural. So the eyebrow transplantation is a method where I borrow hair from the back of the head, and then take those hair follicles one by one, each hair individually transplant into the eyebrows in the right flow, so toward the middle of the brow near the nose, facing upward, and then they'll start to flow this way in a very natural pattern as they come over. So I design the brows with the patient in mind and facial features, and of course, something that you agree upon. But I am responsible for making sure that the hairs grow in the right direction to give you a completely natural look when it's all said and done. And that's what matters most. I mean, you really want to have a very natural looking eyebrow.
Yeah.
Being an eyebrow transplant surgeon, I have seen patients who've done these procedures elsewhere. Maybe someone who's not as experienced, and eyebrow hairs sometimes grow straight off of the face, which never really looks natural. And then it's a permanent procedure. Once the hair is transplanted, it's really hard to reverse that procedure. So the last thing you want to do is have the hairs growing in the wrong direction after you've gone through all this trouble of microblading and that didn't work, and trying to grow your brows back and that didn't work, and then you do a transplant and then that doesn't look good. So you certainly want to go to a surgeon who's very experienced, has an artistic eye, and really knows what they're doing so that you really get the best results. And so in my practice, I spend a lot of time drawing in the eyebrows, paying attention to the natural flow of your hair if there is some present. And I've created eyebrows from scratch with nothing there. But I spend a lot of time focusing on making sure that the eyebrows look extremely natural when they start to grow in.
Okay.
So the process works after we transplant the hair into your eyebrows. The hairs will be there for approximately 2 to 3 weeks, and then they go through a natural cycle of hair shock where most of the transplanted hairs actually fall out. Then at 3 to 4 months after surgery, you'll start seeing your hairs growing back in again.
Okay.
Once they start to grow in, then it doesn't take very long for them to get to the length of a natural eyebrow. because they're from the back of the head, which is usually the best place to borrow hair, they will grow as long as they want to, like they're on your head. So you do have to do a little bit of maintenance, maybe once, twice a week at the most, where I recommend just brushing everything up, trimming across the top, and then brushing down, trimming across the bottom, and then just brushing over, and that'll look extremely natural and give you the best shape.
You don't get any scar in here, no scars.
From no scars specifically, I mean, I do have to make little tiny incisions for each hair. So each little hair follicle is going to be placed into an incision in the skin. So anytime we injure the skin with a little incision, there was going to be a little tiny bit of scar tissue that forms. I mean, that's natural. That's a part of surgery, but you won't see any of that. And it's going to be just around the hair.
Okay.
And so it blends in with everything else. It's not like the microblading tattoo scar or anything like that.
Okay.
So no excess scarring or extra scarring or anything like that. No, not at all.
Perfect.
Okay. So other things about the procedure, in the back of the head here, very minimal pain, if any at all. I do give pain medications to help with any sensitivity. Most patients say that it feels a little tight and maybe sore for 24 hours at the most, and then that's over. In the front, no pain at all.
Okay.
The hairs are very superficial. You might notice a little bit of swelling. Maybe some patients will bruise, so you might have a little bit of bruising around the eye for a couple days, and then that tends to fade.
Okay.
You can take things like Arnica montana or bromelain, which helps reduce bruising and swelling before surgery, and avoid medications like aspirin, Motrin, ibuprofen, those kinds of things that can cause excess bleeding during the procedure or after the procedure.
Okay.
Other things to know, at home, no exercising for approximately 10 days after the procedure. And avoid washing your eyebrows for the first 5 days. That's really important. The hairs aren't really seated in place and don't really hold on to the surrounding tissue until about 5 days after surgery. Post-operatively, you just want to be very careful that you're not washing your brows, that you're not wearing clothing that you pull over and pulls the brows out. So you have to be very careful with that kind of stuff.
Okay.
Okay.
Perfect.
So what I want to do, any questions about any of that?
No, I will be awake, right?
Right, that's a good question. So during the procedure, you are awake, but I give medications to relax you. So it's done in an office setting, outpatient, under local anesthesia. No general anesthesia is required.
Okay.
I inject local numbing medication into the back where I'm borrowing the hair, and also into the eyebrow area so that you don't feel anything after that. I also give you a relaxing medication to just kind of help you feel a little more sleepy. Mm-hmm. And once the medication takes effect and these areas are numb, most patients actually drift off to sleep and sleep through most of the procedure. So it's an extremely comfortable procedure.
Okay.
Okay.
Perfect.
On average, the procedure will take about 4 to 5 hours, depending on how much hair has to be transplanted, or how much work needs to be done. And then also with the complexity, sometimes scar tissue, if it's present from microblading or trauma or things, can take a little bit longer. But on average, 4 to 5 hours.
Okay.
Okay, so I'm just gonna remove your makeup. I wanna have a look at your eyebrows and see what kind of a pattern we're going to achieve. We'll draw your eyebrows out with you. I see your microblading pigment underneath here. So I see what happened was you've got the bottom part of your eyebrow and you're missing hair here and a little bit on the top. And so with the microblading, you attempted to fill in this top part to give you a little fuller brow, but that three-dimensional effect is just not there.
Yeah, it looks like a tattoo.
Right. Right. So this entire area right across here is missing hair, and that's what we need to fill in, starting with the center of the brow and coming all the way out, and give you a little bit softer arch rather than this really higher arch and a thinner tail over here.
Yeah.
So I would think we're just going to do a little bit underneath here. So certainly we need to put some hair up here across the top, but I also think that putting some right underneath here will soften that arch a little bit.
Yeah, because I don't like it like too
Right, you don't want it too high. I
Too
agree.
high.
Looking at, you don't want a really surprised look. So softening underneath here. So when I'm transplanting the hair in the center part of the brow here, I'm going to place them so that they're growing straight, up like this, close to the skin.
Okay.
And they're going to grow up like this. In this part here, they're going to do this here, that direction, and then as they fade over, I'm going to start transplanting them this way, and then on the top up here, they're going to start going down like that, and over here, they're going to go like this.
Okay.
So I take a lot of time during surgery when I'm designing these, when I'm making the incisions, to make sure it's all going to flow very naturally and look like a completely natural eyebrow when it's all said and done. So this will be the plan.
Okay.
And that'll be the border of your brow, and I'm going to transplant hairs into that area.
Okay.
And give you a completely natural looking brow.
Perfect.
So a lot of people are asking or saying that it looks like she has great eyebrows. So I wanted to show you guys a close-up, like what concerns Anna about her eyebrows. And so she microbladed into this area, and if you look really closely, you can see the hair stops right here, and all of this above is microblading pigment. So these little lines from a distance may look like hairs, and that's what microblading is intended to do. But when you really look at it, it's not three-dimensional. It's painted onto the skin, basically. And so all of this area needs hair to actually look like a natural eyebrow. So I'm going to be transplanting hairs into all of these areas above the brow, and then also if I pull the hairs up here below the brow where there's gaps underneath here. So all of this will be transplanted too, to give it a fuller brow and a more shapely brow. And then on this edges here, giving more of a tail to extend the brow out where there is no hair out here either. All right, Anna, we're all done. I want you to have a look.
Okay. Wow. No, it's amazing. Wow. Love them. Yeah.
See how we were able to fill in the top here?
Yeah.
And then across the top
Yeah.
there.
I love
Nice and full.
Wow.
Gives you a lot better of an arch.
Yeah.
Softer. Brings out your eyes. A little bit of swelling and a little tiny amount of bruising, which is normal.
Yeah.
That'll go away in a few days.
Okay.
Okay?
Wow, it's amazing. Wow, I love them. Yeah.
Perfect.
Love them.
Perfect.
Yeah.
Yeah, I love them too. I think they
I
look
love
great.
them. Yeah.
Good. Good.
Woo.